infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to the show. Now today we're going to look at some non-communicable health conditions, namely hernias, something you may be aware of, you've experienced, or you probably know somebody that has dealt with this. Now joining me today to talk more about hernias is Abhishek Parmar, MD. Dr. Parmar is an assistant professor in the Division of Gastrointestinal Surgery at the University of Alabama at Birmingham. Dr. Parmar, welcome to the show, sir.
Thank you so much for having me.
You bet. So, what exactly is a hernia?
Sure. So we all have a strong sheet of connective tissue that holds our vital organs, intestines, and everything inside. And what a hernia really is a hole in that connective tissue, and it can happen kind of anywhere, in the abdominal area.
Now, how common are they?
It's hard to say. I think anecdotally we all probably know some people who have hernias. The last study I saw said that I think over 5 million Americans have hernias. If you look at how commonly we fix hernias, I think 700,000 hernias were fixed last year, inguinal hernias, and 350,000 ventral hernias were repaired. So it's an incredibly common problem, and it's one of the most common surgical problems we see.
Sure. It's actually personally interesting to me because I recently had my gallbladder removed, and while the surgeon was doing the pre-op examination, he also determined I had a hernia in my umbilicus. I had no clue. So,
right.
Yeah. So who's most at risk of getting a hernia?
Since it is kind of a mechanical hole in the abdominal wall, probably the people that are highest risk are people who've had a prior operation. Of course, in order to take out your gallbladder, I'm sure the surgeon made some incisions to get through. So, those are the patients who are at highest risk. Anything that increases the pressure in your abdomen, so chronic coughing, sneezing, people who have bad lung disease, and then people who have risk factors for weakened tissue in general. So older patients are higher at risk. People who smoke, smoking is a huge risk factor for developing a hernia. So is obesity and diabetes. And men are more at risk for developing groin hernias because of how their testes descend during development. So.
Now, are there serious medical complications associated with it? For example, if you don't have a hernia repaired?
Sure. And historically, I think lots of surgeons and doctors used to be incredibly worried about hernias because, the scariest thing that could happen is a loop of intestine can become caught in a hernia and lose its blood supply. We call that strangulation. Mm-hmm. So historically, we would fix every hernia we ever came across. What we learned, though, through recent studies over the past decade or so is that actually that event happening especially in inguinal hernias is quite rare. It happens in about 1 in 1,000 patient years. So it takes 100 people 10 years to live for this to happen to one patient. Of course, that's kind of an estimation based on some studies that that have been performed in the past 15 years. But now it's a scary sort of thing to happen, but we realize it's more uncommon than it is common.
Now, in the interview so far, you've already mentioned a couple different types of hernias, but there are quite a number of hernias, different types. Can you talk about that?
Sure. So probably the most common type of hernia is a groin hernia, which I mentioned, which is more common in men. But, hernias can happen in any number of areas because it's just a weakening in the abdominal wall. It can happen kind of like you had by your belly button. It's called an umbilical hernia. It can even happen on flanks, called lumbar hernias. It can happen when people have prior colostomies, called peristomal hernias, and then it can also happen through the diaphragm, which is called a hiatal hernia.
Is there
many different types?
Is there a difference in seriousness between the different types?
There can be, and hernias are variable in size, shape, and type, and of course, patient. So, it's kind of a difficult thing to summarize in a few sentences, but absolutely, some hernias can be, more uncomfortable than others, or risky.
Concerning treatment, is it always surgery, or are there other options?
Unfortunately, it's because, again, it's a mechanical problem. It's really hard to be able to address it with any medication. So it is surgery, but like I said, for most hernias, the risk of observation is quite low. And again, this is all that should be tailored to each individual patient. But, because of that, surgery is the only treatment, but it can sometimes be delayed if someone prefers.
Right. And let me go ahead and close out with this. Any final thoughts you have for the listening audience?
Sure. I think, as I mentioned, hernias are extremely common problems, but I think what we've learned over the past 2 decades is that it really takes a surgeon who's very thoughtful and takes a careful approach to hernia management. There are a lot of downstream effects to, surgical treatment of hernias. People can develop pain, the hernias can come back, lots of sort of things. So I think it's important for patients to see a surgeon who's focuses their practice on hernias, and I think that's how they can get the best outcomes.
Very good. Well, thank you, Dr. Parmar, for your time and your expertise. I appreciate it.
Oh, thank you so much.
You're welcome.